Hey guys, welcome to the show. This is going to be a short podcast about the drug Ivermectin produced by Merck and if it's actually good or not good for COVID-19. So it's all over the news right now. Fox News and especially their entertainment comedians, their hosts like Sean Hannity or Laura Ingraham or Tucker Carlson. These are the people that do pretty much opinion shows, and they do whatever they can to get ratings up and to rattle their base, keep them all hyped. But the reality is that right now they're pushing this ivermectin narrative, and it's leading to a lot of problems. Let me just say right off the bat, ivermectin is not approved for COVID-19 treatment or cure. Not at all. So let's see, first of all, what's going on different platforms. First of all, with the FDA. The FDA published on Twitter, I came across this today and I was like just baffled. I was in shock in terms of how blunt they have to be, like how naive you have to be to not even read, like you're not taking advice from your medical doctors. You're taking advice from some comedians on TV. They're giving you medical guidance. How is that even possible? And so look at this, they have to say, you are not a horse. You are not a cow. Seriously, y'all, stop it. And then the article is titled, Why You Should Not Use Ivermectin to Treat or Prevent COVID-19. I'm going to tell you something. I saw this and I thought this was a joke. I'm like, no. This graphic, let me put it on screen again. I'm like, this cannot be official. This has to be doctored. This has to be Photoshop. You have the FDA telling people you are not cows. You're not horses. Please stop it. I'm like, nah, this has to be a joke. But when I went to the account on Twitter, it's an actual legit tweet that was posted. Why? Check this, coming from Mississippi, out of Mississippi. This is published on Forbes, but it's all over the news. You can find it on any platform of your choice. It says, the Mississippi Poison Control Center has been getting more and more calls from people feeling ill after taking ivermectin, and at least 70% of the recent calls have been related to ingestion of livestock or animal formulations of ivermectin purchased at livestock supply centers. So people are going around to livestock supply centers buying ivermectin, and why not? You have Fox News saying that this is like being widely used all over the world, that this is working. Why are they not allowing us to use it? Why are they not supporting the use? Let me show you on a video that MSNBC put out. It was like Rachel Maddow, I think it was her show. Yes, it was her show. Check this clip and see what's going on at Fox News and why people are running and rushing to these farm and livestock supply centers. Imagine this, 70% of the people calling to poison control centers are because they are taking this ivermectin drug, which is not intended for COVID at all. It has been used for a lot of other conditions, but not COVID-19. And guys, this is a very serious thing. The fact that you can take some drug for one condition doesn't mean that it's going to help you with other condition, that it's going to be safe to take it for that other condition. Not at all. So let's check the video.
People are just swamping the system. In that state that frankly has enough to deal with, they are now facing a new challenge related to COVID. The Mississippi State Department of Health confirming today that, quote, at least 70% of the recent calls to poison control in Mississippi have been related to ingestion of livestock or animal formulations of ivermectin purchased at livestock supply centers. Ivermectin. Why are people taking livestock formulations of ivermectin in Mississippi? Ivermectin, livestock formulation, that's a horse dewormer. Literally, people won't take the vaccine because they're super suspicious of that, but they're taking horse deworming medication that they're buying at a feed store for COVID? Why, on top of everything else Mississippi has to deal with right now, why are they dealing with this? I don't know, but I have a guess.
We know that our FDA has in many ways failed us by not allowing for the use of ivermectin and hydroxychloroquine, both of which are used around the world to reduce COVID hospitalizations and deaths.
I pelted them with questions about COVID-19 and the vaccine and therapeutics, hydroxychloroquine, ivermectin, as well as other proactive treatments and practices were already helping COVID-19 patients all across the country.
On June 5th, Weinstein discussed the benefits of a drug called Ivermectin, which can and is around the world used to treat and prevent the spread of the coronavirus.
That's not true, guys. That's not true at all. You can see that they claim, Laura Ingraham says that the FDA is failing us because they don't allow us to use like this treatment. Hannity says that it's helping people all across the nation. And then Tucker Carlson says something like, it's helping people, with COVID all around the globe. It's not actually true. It's not approved. If there's any off-the-label use, that's a completely different thing, but that's at your own risk and that's at the doctor's risk. And some people, if they're about to die and they have nothing else to try, some people may want to go that route. So this is very, highly irresponsible, guys, because in all reality, this is not intended at all to be used for COVID-19. Let's first of all check what the actual pharmaceutical, the company that makes this drug, Ivermectin, is saying. Let's check it out. So as you can see here on the screen, this is a statement. They had to put out this press release. Company scientists continue to carefully examine the findings of all the available and emerging studies of ivermectin for the treatment of COVID-19 for evidence of efficacy and safety. It is important to note that to date, our analysis has identified: number one, no scientific basis for a potential therapeutic effect against COVID-19 from preclinical studies. Number two, no meaningful evidence for clinical activity or clinical efficacy in patients with COVID-19 disease. And number three, a concerning lack of safety data in the majority of studies. We do not believe that the data available support the safety and efficacy of ivermectin beyond the doses and populations indicated in the regulatory agency-approved prescribing information. I'm going to read that again. We do not believe that the data available support the safety and efficacy of ivermectin beyond the doses and populations indicated in the regulatory agency-approved prescribing information. Damn, sorry, Fox News. That's that's a takedown. The pharmaceutical itself is telling you this drug is not intended. We do not find sufficient evidence, studies to pretty much support the idea that ivermectin can be safely and effectively used in preventing or treating, let alone curing COVID-19. So when you have the own pharmaceutical having to come out and put out a statement, guys, this is a big deal, and they're putting out the data out there like right off the bat, telling you there's no data to support the claims. Let's continue. Let's move on. There's this from another trial that it was posted on the NIH. Somebody sent it to me. It's like a 5-day course of interventions that they did. It says, I'm going to read just the last part here. Just search for ivermectin study. Go to the NIH. You're going to find it. But it says at the end, because this was presented to me today by a friend of mine saying like, oh, this is one of the studies. There's studies out there. There's studies, but they're not conclusive. And they're saying and arguing clearly that more studies are needed. So for clinical trials, if you go to the actual WHO page, they say that ivermectin is approved right now for clinical trials only. So that's what's happening when it comes to clinical trials. This precisely is that. It's one of those studies. They're trying to check if there's any efficacy, any effectiveness, any good results. And they conclude saying, I highlighted at the end, a 5-day course of ivermectin was found to be safe and effective in treating adult patients with mild COVID-19. Larger trials will be needed to confirm these preliminary findings. So some of these studies have actually compared certain type of patients, if they're mildly ill or if they're seriously ill. And in other cases, they have considered patients that are very, very sick. And it's a combination of medications. It's just not ivermectin, but it's just clinical trial, guys. This is very small samples. They're saying that larger trials are needed. And I'm going to continue. Look at from the NIH. This is another page that was sent to me like, oh, this is another study, more information that you should check. This is already out there. It's been, use it's been successful. It's not the case. When I open the page that the person sent me, look at what it says from the NIH. So I'm going to zoom a little bit in, like, closer. So this is actually from the NIH, and they're stating clearly that ivermectin is already being used and it's approved for certain conditions, but it's not for COVID. If you actually check the last sentence, it says ivermectin is not approved by the FDA for the treatment of any viral infection. So it's clearly disapproving the use for COVID. It's being used, yes, it's widely used, like Fox will say, but it's misleading because they don't tell you that it's widely used for other conditions, not for COVID-19. And we don't know much still about COVID-19 when it comes to certain treatments and medications. So it's highly irresponsible to cause the impression that this is completely safe, it's already being used, you have nothing to lose. That's not the case. So let's check by the WHO. This is the World Health Organization. If you go to their page, you can pull it up. You can search by ivermectin. You're going to find this statement saying the WHO advises that ivermectin only be used to treat COVID-19 within clinical trials. So, guys, not much to say. I don't want to really go on with this video, making it longer than it should be. Please don't take advice from clowns on TV. You have to listen to the medical, professionals. You have to listen to the scientists. You have to listen to the WHO, to the CDC, the FDA, the NIH. Go to the actual source of useful, trusted, and scientific information, guys. It's sad that we have to come to a point in which you have the FDA saying, seriously, y'all, stop it. You are not a horse. You are not a cow. It's sad. It's sad. And Fox News is doing such a disservice to the American people by promoting unsafe and unapproved treatments and pretty much selling them like they're actually safe. They're not. Studies are not conclusive. We don't have enough studies. And you have pretty much all the official entities telling you, don't use this for COVID. Don't use it for treatment. Don't use it for a cure. Don't use it for prevention. It's still not safe to do so. So let me know what you think. Do you think this is, the information is clear? Do you think there's any other information that we're missing? Do you think the Fox News entertainers like Tucker Carlson, Sean Hannity, Laura Ingraham, do you think they're doing good at all by spreading this kind of information or misinformation? Leave me some comments. So finally, please subscribe to the channel, like the video, or unlike it if you don't like, if you think it's crap. Just, participate. I don't care. Leave me a comment. Tell me what you think, if you're in favor of using ivermectin or not, and why, if there's any evidence that I maybe didn't see, that I didn't share. But like I said, I'm a data person. It's all about the evidence. If official entities, organizations, official agencies, the medical professionals, colleges, doctors, whatever, scientists, if they are not saying that ivermectin is ready for use for the public, for the prevention, treatment, or the cure of COVID-19, guys, we have to say checkmate. This is debunked. Ivermectin is not safe. It's not even recommended. And even the pharmaceutical is telling you don't use it for COVID-19. So I'm going to wrap it up. I'm going to leave it there. Thank you for tuning in, and stay tuned for more.